You know what I will do is let me talk through this, and and I know the board members. I sent you each a document earlier this evening in regard to what I was going to speak about, but I was not going to. The slides were briefer. It was not. I was not going to go into this depth. But what I wanted you to have was have the information, so that if you got questions from the community, you could respond in this fashion. So back when we came back on January 4th, the superintendents were all alerted about the false negative tests in regard to Curative. So we, as the 23 superintendents within San Mateo County, met with our county superintendent, Nancy McGee, and also she had previously met with the county Department of Public Health with Dr. Scott Morrow, who is the health officer for us. And also there is Dr. Chan, who I believe his title is like the deputy health officer, if I'm not mistaken. You may know better than I, because some of you are on these calls on every other week with these public officials. So what they told us was that definitely when we came to the decision to use Curative, there were definitely going to be some false negatives and some false positives. That's just going to happen. It's the name of the game when you're doing a test in this fashion. It's self-administered. You don't have a clinician or a health provider that is looking at you exactly in the manner of how you're doing it and that you're doing it correctly. We've all been trained using a video, which we all viewed prior to using the Curative test. Plus, every time we get the Curative test, we could watch the video, because I know one of my directors does that every time. Or you can look at the sheet that's inside the Ziploc bag that tells you the steps to go through and what you should be doing. So with all of that being said, the county officials at the county health departments for the Bay Area counties of Marin, Santa Clara, Contra Costa, Riverside, and San Mateo all agreed that we would continue to use this lab as advised. All the labs will be performing these tests and are necessary to meet the California demand. And they also indicated to ensure the most optimal specimen for testing, it is recommended that the test takers be retrained and reminded to do, number one, refrain from eating, drinking, or brushing your teeth at least 20 minutes before taking the test. And number two, swab per video instructions for the required 30 seconds. Dr. Morrow, who is our health officer for San Mateo County, said that Curative is submitting new data to the FDA. And since Curative does much of the testing, they have a much larger sample size, especially for asymptomatic individuals. He also went on to explain that they expected updated sensitivity and specificity in asymptomatic individuals to be available soon. So there is additional information that they're sending to the FDA, the advisory, and with this additional information, the FDA may not even look at this anymore. So we're waiting for that information. And also there is another lab that's coming into play for the state of California, and they're called Valencia Labs. They are looking for approval, which from my understanding is coming in the very near future. The county office is working on the paperwork that will be needed. So if we as districts determine to use a different test, the county can help us support this one. But that's not come to us at this point in time. Hopefully within the next week to 10 days, we will learn more about it. But it's the recommendation from those county public health officials that we continue to use Curative. In San Mateo County, even those who started with a different provider are using Curative now, the districts within the county, and we're all going to continue to use it. So as I get updated information, I will make the board aware of it. I will make teachers and staff aware of it, and also the community. This Friday, there will be going out a communique to our community and also to our teachers and staff about this issue. So this was a couple of the slides that hit on these items that I just spoke about. Are there any questions in regard to this from any of you? And as I said, I sent you the exact wording, but I didn't read everything that I have. Well, here it is.
Finally.
Yay!
Perfect. So let's go down to slide number 3. So again, here, San Mateo County is to continue with Curative. Curative made it clear early on of the possibility of false negatives. The Bay Area health officials, as I stated, most new lab tests have similar challenges. Most labs that are coming out are having these challenges. The next slide. Again, the health officers and the counties that I mentioned, which were Marin, Santa Clara, Contra Costa, Riverside, and San Mateo, were all going to continue to use this test. And then I talked about the reminders and the proper manner of how to administer the test, and the reminders about no eating or drinking, brushing your teeth before the test, at least 20 minutes before you take the test. And as I said, Curative is submitting additional information to the FDA, which may make this not a non-issue anymore. And if that occurs, I will let you know right away as soon as that happens. Any questions?
So let's see. So we do have one speaker card on this particular topic. I don't know if we want to take that first and then questions from the board, or if board has any questions, we can do that first.
I'm sure those of you, the board members I'm speaking to, who have the call with the county, and I believe that call is tomorrow, if I'm not mistaken. This is going to be probably one of the items on that call.
Yeah, so we don't have a call. We now have them every other week, so we'll have a call in a week from now.
Okay, all right.
Yeah, but I similar to the information that you got, I contacted the county superintendent of schools, Nancy McGee, and basically you've had the same conversation. So the information that you've shared is basically the result of her conversation along with the county health officer. So yeah, I agree with it. I mean, I think we need to continue to use Curative and just try to have staff use it to the highest fidelity possible, with following all the protocols and everything. And that, it is working with the, although there will be some false negatives. And so.
And then there's a question about how many school districts in the county were all using it. Menlo Park just set up this huge, I want to call it a drive-through, but it's not a drive-through, across from MA, where there is, what is it called, the SRI offices, or where they have their community members that can, take it on a regular basis there. I forget how many days per week, and also offered it to any of us who are districts that are close to them. Hillsborough started out with another test, but has gone to Curative. So the districts within San Mateo County were all using Curative in some fashion.
I know in talking to the health officers along with Superintendent Nancy McGee, and then the important thing is that we're following the health protocols that we've set up, and the testing is an extra layer of protection, right? Because it will give us some information. But the reality is we're doing the daily health forms, we're doing the temperature checks, we're following all the health protocols, the social distancing, the masking, the hand washing, you know, all of that. So people should be protected within the workplace. And we haven't been seeing transfer of COVID within our workplace.
Right.
It's mirroring what we're seeing in the community. So there are positive cases, but we're not seeing the transferring within our own community, right? Within our own school community.
In our own school community. When a person tests positive, there's this elaborate process that if it's an employee, it's Aaron Keikos at this point in time that is handling it. If it's a student, then it's Antonio Perez. And there has not been a case where it's been one of our employees or students who has tested positive, and then it's gone out into the school community where others have tested positive. That has not happened here in Redwood City, within the Redwood City School District.
And I actually think that's been true within our county. And we've had schools who were operating during the summer and had the same result. So they were not seeing any transfers within the community. So if there was a positive result, it was a result of getting it outside of the school community, and then the protections within the school community prevented it from transferring out to staff and other students. And I don't know that we've had any cases of transferring in the county within our school system to date. I don't know, Dr. Baker, if you've heard otherwise, or any of the board members.
I have not heard.
I'm always asking that question of the county superintendent.
Right, I have not heard that either.
All right, so if the board doesn't have questions right now, should we take the comment from the public?
Sure.
It's actually one of our teachers. So Pam Barish, would you still like to speak? We can move you to a panelist. Can you find her, Kyle? Great.
Okay.
All right, welcome, wonderful teacher.
Good evening. Happy New Year, everybody. John, you kind of took the thunder out of what I was going to say, but I'm going to say it anyway.
Oh, Pam, I know. I just knew you would. I know you too well.
Well, then you know what I'm going to say.
Yeah.
Good evening, everybody. Thank you for the opportunity to speak before you tonight. As you all know, I sent you an email over the weekend regarding what I'm speaking about tonight, and I want to thank Elisa, Mike, and Wendy for getting back to me with their responses and information. For those of you on this call tonight, let me bring you up to speed. I am Pam Barish, a kindergarten teacher at Henry Ford School. I, like many in our district, was thrilled back in the fall when RCSD said they would provide COVID testing for their staff. I've been faithfully coming to school every 2 weeks to swab and receive a test from Curative Labs. Imagine my dismay last Friday night to read and see the news that the FDA has said Curative is producing too many false negatives and should only be used as a testing option for those showing COVID symptoms, not as a preventative monitor. Does anyone else see a problem? I am duly concerned that when I get an email that says I am negative, I have to wonder if I am really negative. I have enough to worry about between my family, my students, and the world I live in. I would like to know that when I take a COVID test, I can believe in its accuracy as we can at Sutter, Dignity, Stanford, or Project Baseline. They did not make the news in the past week. The feedback that I've gotten from the board and RCSD states that the county is not terribly alarmed and looking into alternatives. At the same time, the news this week has reported many counties and districts in California and in the Bay Area that are opting out of contracts with Curative in search of more effective testing alternatives. I am of the belief that if the Food and Drug Administration is saying something, it has to be backed by a great deal of factual evidence, and I should listen to it, not brush it under the rug as we seem to be doing. San Mateo County and Redwood City specifically are in the midst of a spike, not a decline, and the holiday surge has not even hit yet. I personally have made the choice not to come back into the classroom next week, but I have colleagues who are, and I do come to school to prep and put out materials on a weekly basis. I am imploring all parties to look at the facts. Please make certain that the tests we are using and receiving and offering to our families now are producing accurate data we need to stay safe in the weeks ahead. Thank you for the time to speak. Please stay safe yourselves.
Thank you very much for your comments. I don't know, Dr. Baker, if you want to say anything more. I know that you gave I think you answered some of the questions.
It's just that, you know, as superintendent and as other superintendents within this county, there are 23 of us, we are following the lead of our county health officer. And it's not to say that we're, as Pam alluded to, just brushing it under the rug. We're not. We are also looking at this other entity, Valencia Labs, to see what they can provide for us. And once that is brought to the forefront, then I'll also be bringing that to the board so we can have a discussion about it. The next piece of this presentation, if we're done with Curative, is the rapid result antigen test. And if we can go on to I think the next slide. So this is another test in which is being highly recommended by UCSF. What this is a test that I'm going to pilot within the Redwood City School District at 2 of our school sites. That's Henry Ford and Taft. If you ask why Henry Ford and Taft, Henry Ford and Taft were the initial pilot schools along with some others, but these 2 sites at the time had more students and more teachers and staff on the school site. This pilot was brought to my attention back before winter break when myself and a couple other superintendents in the county were asked to attend a virtual meeting that was being presented in Southern California. The group Binax Now is a group out of UCSF who has come up with this rapid test that you swab your nostrils, each nostril, for X amount of minutes with someone monitoring you, how you're doing it. And then you put it into a card or an envelope. I have not seen it. We have another training tomorrow at 10 o'clock. And then within 15 minutes, it tells you if you've got the COVID antigen. If you have it, then you have to immediately, you go into quarantine, plus you take a lab test. This is an 8-week pilot, and the test is given 2 times per week for teachers and staff, and for students whose parents allow us to. There has to be an agreement and a signed document saying that the parent gives its permission. UCSF has now determined a high level of accuracy with this test. This test costs $5 per each time it's utilized. The cost at this point in time is being picked up by the Chan Zuckerberg Initiative. And as you are aware, the Chan Zuckerberg Initiative, CZI, works very closely with the Redwood City School District. They also work closely with Ravenswood. And so Ravenswood is one of the other school districts that's going to be piloting this, even though there are no in-person classrooms, there are only learning hubs that are sponsored by the Boys and Girls Club. Now, La Honda Pescadero is the other school district that is going to pilot, and they are in person pre-K through 5th grade. And they are starting to pilot next week, if I'm not mistaken. Next slide. Oh, sorry, if you go back, Wendy, I'm sorry. I thought there was one more after this. So after the 8 weeks, there is going to be an evaluation among all the school districts who have moved forward and piloted this test. Those districts in Southern California, those districts in Northern California. In Northern California, it's only the San Mateo County, our 3 school districts, and another district that's in Merced County. If it is as accurate as UCSF continues to adhere to their evaluation and their studies, if that is a test that will be offered to us, I would at that time look into it more thoroughly and bring it back to the board for consultation. At this point in time, as I said, it's a pilot. It's for 8 weeks. You have a test 2 times per week, and when that test is administered, I have to make sure that we have a nurse at each of those school sites. Questions?
Dr. Baker, there's one question in the chat. Will this new test be administered 2 consecutive days or spread out to beginning and the end of the week?
That's a very good question. I'll find that out tomorrow. Myself, along with the administrators from each of the school sites, are going to attend a virtual meeting at 10 o'clock tomorrow. And at this meeting, we'll get that information. The other piece is that Aaron Keikos, Antonio Perez, and Shanna Leahy will also be there from the district office. And then we'll have our nurses, 4 of our nurses will be there also, along with Andrea Guerin and also Kathy Ibarra, to learn more about it and to hopefully, I'm not sure if it's going to start next week on the week that we come back on the 19th or the week of the 25th. And we have to figure those logistics. They did drop off 1,000 tests yesterday for us to start with. So hopefully I will have more information at our next board meeting and be able to give out information to the community and to the staff in the Friday update letter that goes out next week.
Well, I appreciate your leadership in this. I've been hearing about these kinds of rapid tests, and these could be game changers, right? So it's really great that we're able to help do some of the work on this. One other chat question, and then we can see if the board has any questions. How far deep in the nose is the test?
That's a good question. I don't know how to answer it at this point in time. I know they said mid-nasal. That was, but we'll find out more information tomorrow, I'm sure.
Okay. And then will remote teachers at Ford need to come in twice a week for testing also?
Yes.
Remote teachers as well?
Yes. I'm putting them on the list. And the rationale for doing that is because the remote teachers come into classrooms to, from what I understand, sometimes they're making packets for their students, so they're there for a period of time. But I want to make sure that while they're there, if anything is occurring COVID-wide, that they should be also able to take the test, just like we do with Curative.
Great. All right, are there other board questions?
I have one. Yeah, go ahead, Cecilia, you first.
So John, when you mentioned that you need a nurse to be there to administer the test, what will happen if, say, a nurse is absent for whatever reason? Do you have somebody else that would then be a backup to make sure that staff is getting tested?
Well, the office staff that is there and the principals are also going to be trained in HIPAA guidelines in case that were to happen. But at this point in time with these 2 schools, we should not have that issue.
Great, thank you.
And then for the 8 weeks of this pilot, is that replacing the curative test, or will people, or whatever is the replacement for that, or will they continue to do the regular testing and this is just on top of it?
No, this is not, no, we're not continuing the curative test for 8 weeks.
Okay.
And then remember, testing is only one of the manners to keep us safe. We still need to maintain those protocols. We still need to adhere to them at all times. And you all know them quite well. And so do the teachers and staff who are at the school sites.
Yeah, I wasn't sure if this comment was for now or for the reopening schools part, but the redundancy in the recovery framework and in the school plans for safety protocols, I mean, they seem to me like they're kind of put in there for the failure that testing might have on the edge cases, the masking, the social distancing, the hygiene, the quarantining, the reporting, and the self-reporting. Just they're all built on top of additive layers on top of testing, and if anyone fails, we have these other things to be able to detect it. So that gives me comfort.
Correct.
And like was said already, we've seen that those work. All those practices that we have in place. We are not seeing the spread in our hubs and the groups that have been open, from October and November on. So yeah, I don't know if this belongs here or not, but I had somebody asking me the other day how I feel about my own son going back into class on Tuesday, and I said I feel comfortable with it. I know, we're not seeing the spread. We're catching the positive cases, and those groups are going back in to quarantine. But I'm not afraid of my own child getting sick by going to school.
All right. Anything else on testing? All right. Well, thank you for all your work that you're doing on it. Really appreciate it, Dr. Baker.
Okay. Next slide, please. This is something I'm sure everybody's interested in hearing about. This is the vaccine distribution. So to give you a little background, there were 4 of us superintendents that felt that we needed to become involved in some manner with this distribution of a vaccine, especially those of us that are having in-person learning, whether it be in the classroom with in-person learning or whether it be a hub, as we have a lot of hubs throughout our school district that are provided by our partners, and we have a lot of hubs that are Redwood City School District hubs throughout the district. Plus, we have our wonderful staff and teachers that are back to do in-person learning. So we wanted to see, there's 4 of us, and the 4 superintendents at the Menlo Park, the Las Lomitas, the Portola Valley, and myself, and also we brought in Hillsborough to see what we could do as a small group with our county superintendent. Could we meet with, we met with her to ask for assistance, because alone we were not getting anywhere. So we asked her if she would please connect with the county health department, and would she please connect first with Kaiser. What we wanted her to do was to make sure that our teachers who were doing in person and our staff that was in person at school sites would be at the top of the list for the vaccine. So Superintendent McGee met with Dr. Morrow. Dr. Morrow agreed, but Dr. Morrow did say the county health department does not have the means to do all these admit all these vaccines to our teachers and our staff. So she brought up the idea of Kaiser, and he says, if you can get Kaiser to help us out, that would be great. So Superintendent McGee has been working closely with Kaiser. And at our meeting yesterday, I know she had another one late this afternoon, but we haven't heard anything from it. But if we go in that direction with Kaiser, that means that Kaiser, along with assistance from each of the school districts using some of our nurses, will be able to vaccinate our teachers and staff who are right now doing in-person instruction. With that being said, as superintendents were meeting yesterday, there were a group of us that got together again to ensure a draft of priorities and how these vaccines would be distributed. As Dr. Morrow indicated, we're getting vaccines every day, but there has to be a priority in how one is going to do that. So the first thing that all teachers and staff members will get tomorrow, the principals, I alluded to this today in a principals meeting about a survey that was developed by the county health department and also by the county office of education. It's a short survey, it's like 10 questions. You all our staff members and our teachers need to complete this by 11:59, I believe on Tuesday of next week. It will determine the number of vaccines for each of our school districts. The next piece that a group of us superintendents worked on was a priority. And there were 6 of us that worked on it, but there are 23 superintendents. And so by the time we finished with it and sent it out to the other 23, of course you can imagine there's a lot going back and forth on this Google Doc. And we finished it last night, right before midnight, to send it to our county office of ed and also to the county health department. What I want to share with you is that I'm very proud of my colleagues who said in the pre-ramble of this draft, and as I broached the subject, saying that some of our communities have populations where we have low SES, people are living in dwellings that are doubling up or tripling up, and so they're more able to possibly come in contact with this virus. So I made the comment that it should start with those school districts that have high rates of unduplicated students. And that's Redwood City and Ravenswood. To the gratefulness of my colleagues, they agreed. And so that's part of the priority, is to start with those of us who have the highest number of unduplicated students. As of yesterday, with Superintendent McGee talking to Dr. Morrow, and also for us pushing that we needed, number one, to get our nurses the vaccine. Our nurses got the vaccine today. So that was a real plus. So now what I want to discuss with you and just share with you, and it's not, as I bring these items forward, this is not meant to be the final, because it still has to go before the county office of ed and the county health department. But this is the manner on how the vaccine will be prioritized, we hope, for the school districts within San Mateo County. So the first, number one, is those people receiving the vaccine will be those who are in direct contact with students and families on campus or district office as a requirement of their job. And those examples include our nurses, but our nurses already, they have it. They got it today. All pre-K through 12 teachers and parent educators who are on site and delivering instruction. All our school site daycare providers, our learning pod staff, our service providers, that's the occupational therapists, that's the speech therapists, it could be our psychologists that are meeting with the students, our school office staff, our site administrators, those campus and yard duty supervisors, the yard duty people, the yard duty supervisors, the cafeteria staff that are working with students, bus drivers who are bringing our students back and forth to school, our substitute teachers, and our instructional assistants who are working with students, and our facilities, maintenance, and operations staff. And also our librarians who are working with students at school sites. That's the first group that is in that first tier for school districts within San Mateo County, along with the piece of starting first with the districts that have the most unduplicated students. The second group would be on campus or district office and interacting with others, but not with students. And those examples are any pre-K through 12 teacher or paraeducator working from campus and using a common campus space, but not interacting with students. District office staff, teachers and staff willing to return once they receive the vaccine and are inoculated. That's the second group. Again, this is a draft. And I just want to keep throwing that out there. And the third group would be other teachers and staff serving pre-K through 8th grade students working remotely. This is the draft that has been sent to the County Office of Ed and will be and is being shared with them and also with the County Health Department. These are the priorities that we as superintendents are moving forward with and would like it done in this fashion. Dr. Morrow said, come up with priorities. We came up with priorities. Dr. Morrow said, if you could get another health entity to help with the vaccines, go for it. And so we're doing everything we can to start this movement as quickly as possible. The first piece is when everyone receives this survey that Wendy Kelly is going to send out tomorrow, do it and get it back to us. It takes probably about 5 minutes. It gives the county office and the county health department the numbers of vaccines that we are going to need to start this work right away. Wendy, I forgot to go to the slide, but I've already go to the next slide, but I've already talked about it. So from here, I will just take questions from the board. So this is all what I've done more than this. This is just the main pieces. All California employees in education to be prioritized. Early learning, TK through 12, and higher education. Next slide. So here you see the County Office of Education, County Health, survey to all employees in education. I talked about that. Districts, we're going to assess the data and provide the information and how the vaccine will then be distributed. The vaccine is administered at county office education locations. If the piece of comes through with Kaiser, that's going to really help the school districts within San Mateo County. Of course, we have a Kaiser in Redwood City. There's also the Kaiser in, I believe it's Daly City. That would help out for North and South. And then the county office locations, they have their location that's in Redwood Shores. Plus, there's another location on Rollison Road where there's this huge warehouse where that can be used also as a place to give the vaccines. And then districts will support this effort by sending some of our nurses to help give the vaccine.
So any questions or comments from the board members?
I just have one quick question because I didn't hear where they fell in. What about like district office staff that visit multiple school sites regularly? Where do they fall in line?
They would fall in the first tier.
Okay.
If they're visiting school sites where they're going into classrooms where there are children, or they're going into the hubs.
And do we have any idea of how soon we can start doing this?
I I can't say. I was told, but I was I can't say.
Okay.
All I can say is soon.
Okay.
So I have a question. I totally understand everyone is very important. But when you talk about, and again, this is just all, what was the word you mentioned? It's not a done deal, but
Right.
if the teachers, so I'm wondering, do we even know how many teachers are willing to get vaccinated? And with
Okay.
that said,
That,
maybe,
that, that's what the survey's for. That's one of the questions on the survey.
okay.
An
So,
important
so
question.
okay, I'm sorry. So say we do know the number of teachers that are willing to get vaccinated. Now, what you just said, the teachers that are working remotely would be in tier 3.
Correct.
However, and again, this is just my thoughts as you were talking. How do we know, or do we know, or would we know if teachers are willing to get vaccinated and come back to the classroom right away? I'm just curious if now that we are putting the teachers that are in remote learning, it's going to, I guess, delay the time of when they will be in the classroom. If they're now going to be at the end of, on tier 3 versus maybe, 1 or 2. And of course, I understand that the staff that right now is in the hubs are people covering, and they're with the students. And of course, because they are with the students, they should also get vaccinated. But again, I was just wondering if switching perhaps, and again, I'm saying this just as, things were just coming up to my mind. So,
So let me see if I can answer your question a bit. So and Wendy, you can take the slideshow down because I think this is the last slide. If I'm not mistaken. Am I correct? I think that's the last slide. So let me see if I can answer your question. Number one, the survey is very important, Cecilia, because the survey is going to give us information. There's questions on the survey. Number one, it talks about, are you going to take the vaccine? That's one of the questions. Then there's other questions about your which health provider you're with, and it lists them. And there's questions about your age and stuff like that. But there's also, if you are we talked about this at the principals meeting this afternoon. If a teacher is willing to get the vaccine ahead of the tier 3, then and willing to come back to school, and we know that willing to come back to in-person learning, they should be on these. We'd have to know that, so that I can make sure that when I create this document that I'm sending to the county office of ed and to the county health department, once all the surveys are done, I'm going to list all those people that are going to get it first. Along they will prefer the city school district, they're at the school site, blah, 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 blah. If people feel, and as we heard in the fall, they really wanted the vaccine, if that's what's going to make them come to in-person learning, then that needs to be stated in the survey so that we can make sure that they're one of the first ones to get it in the first tier. And that would bring them back earlier if they so desire. I mean, bring them back earlier. Plus, as I talk to Wendy and talk to principals, once we have more people that have the vaccine, we need to go back to the union and say, okay, this is what the MOU said, but now we have others that have taken the vaccine. So let's bring those back too. So that's a whole conversation that we would have with the association, plus teachers that are willing to come back now because there is a vaccine and because they will be a priority to get it. Does that help?
it does. Yes, thank you.
I think you
the re-
mentioned this, but in the chat, there's a couple questions about cafeteria workers and the tech workers. I mean,
cafeteria,
because
they're
they would be in the first tier, right? Because they're actively working with students.
right, and parents coming to get the meals and so
Mhm.
forth.
Yeah.
And then at our sites, you know, that are opening up, they're actually working with the kids too. It's really important to understand that the superintendents felt if we did not push, we were not going to get anywhere. We were just gonna, the county was just gonna do whatever they wanted, the county health department. And if we didn't go out and get some assistance from a major entity as Kaiser, that doesn't mean that we can't use like Sutter Health or PAMP or whatever, which we're willing to go to them also. But we asked Nancy to start with Kaiser because for Redwood City, for ourselves, it's our back door. But we felt, especially those of us that were doing in-person learning that we started back in the fall, we don't get this vaccine, people are not going to feel comfortable coming back. So if we can push it and get it out and people get it, I think we can, I know we'll have more teachers that will want to come back into the classroom. I want them back. I know they want to come back. I know you as parents who have the kids want them to come back. So this is a way for us to really move it forward. And I am right now pleased where it is. I didn't think we were going to get this far this soon because we just started. Today's Wednesday, last week on Thursday, meeting with Nancy and the health department, saying that we needed help. And it was only 4 of us that were doing it. And she took it, and it's moving. It is moving. The vaccines are here. As you know, they have, I guess it's drive-in at Maria. I think Lauren sent me a text or an email. I think it's San Mateo.
The fairgrounds?
Yes.
Yes.
And so, and I believe that's where our nurses went today. So it's here and it's ready to go. So we just want to start it as soon as possible.
Yeah, and it falls within the equity guidelines too for the county. I think one of the issues is that there are regulations and guidelines from the federal government and then from the state government as well, and they seem to be changing. So that's part of the issue. The other issue is the capacity of who can come and help, even though the vaccines are here. Not, I can't give it to people. It has to be the medical staff that are trained. So it's within those guidelines. The other thing that they're saying and recommending is that just because you have the vaccine, it doesn't mean that you stop wearing your mask and doing all these other things.
Correct.
It takes a while, and
Right.
we need to continue and be vigilant. So those are just things that we're going to have to keep doing. But I'm pleased to hear that Kaiser may be helping. I know that those forms that you're talking about, other people are also having to fill them out. For the congregate facilities, it has to be completed for each and every one of their patients, for the staff, and it asks if you have insurance. And I think the county will deal with staff that doesn't, with the population that doesn't have insurance, but everybody's trying to get up to speed, and I think everybody has a different way of doing it. So Kaiser was talking about also going to the fairgrounds and doing that through there as well. So I'm glad to hear that you guys are making progress.
And we said we'd use our school sites, but they weren't too keen on that. So I said, let's use the school sites, but they'd rather not at this point in time. But it's moving fast. It's moving fast down the track. And so I urge all our staff, our teachers, when you get this survey that Wendy's sending out tomorrow morning, complete it and get it back. Please, please.
Yeah, and it works by appointment. So once they get the list, then they figure out who qualifies for them those specific list, like you were saying, who goes first. So if they don't have that information, they're not able to give them an appointment. You can't just show up because they have to make sure that they have the vaccine, they have the people that can administer it. So that's the other reason why this survey that you're talking about is so important.
Right, and then the information that we are going to submit to the County Office of Ed and the County Health Department is really important too. And they have not really told us, how they want it done or what platform they want us to use, but whatever we need to do, we're going to do it. Because you could go to, say it's at those 4 locations, wherever the location you feel is easiest for you, you could go and your name would be there on the list. So I'm just, really thankful that the County Office of Ed and the County Health Department is very willing to work with the school districts.
Well, thank you for your leadership, because you were up late trying to get this document done, as well as your colleagues for doing this for our students and our staff. And
I thank my colleagues also for really seeing the concern regarding our population is different than many of the populations within San Mateo County.
Mike, did you have a question?
I did. Thanks. Yeah.
Please go ahead.
This is a great update. Thanks, Dr. Baker. I appreciate it. The one thing I didn't understand was the difference between the tiering. Will it be all tier 1 for all the districts? Redwood City prioritized within that. Then we go to tier 2 across all the districts. Is that the ordering? Okay, so that is the ordering. So it's really important that if someone is making a decision based upon getting the vaccine, that we bump them into the right priority tier. Right. Okay, to be able to get that in. Exactly. Okay, great.
Exactly. And everyone, like I say, everybody got this survey today. Mm-hmm. I got it about 4:30. It came in 4:30, 5 o'clock, and then I sent it to Wendy. Said, make sure, I'll talk about it tonight. Make sure that it gets out tomorrow morning. I talked about it with the principals, but as I told them when we met with them this afternoon, I hadn't heard anything. And then what happens? 4:30, I hear. So here's the survey.
Great. Great job on the proactive steps with the other superintendents. It's great to hear.
All right. Let me see any other, trying to see my colleagues here. Okay. And I know there were some other questions in the chat. I think some of this is still just being worked out. So this was a preliminary update, and just acknowledging that our local superintendents are working together to really advocate for vaccines for our school staff. So, and helping to prioritize what that'll look like. So we can give another update when you have more information, because I think some of the questions people are asking, some of that's still being developed.
So, and the reason why I didn't put this piece that I'm looking at in front of me is because it's a written document that we sent to the county. It has draft all over it, and none of us wanted out in our communities at this point in time. As superintendents, we agreed that we would keep it with our boards, and we could present at board meetings, but we would not be sending it out because it could change. What if they get it and they say, no, we don't like what you wrote? But I don't think so. But I just want to make sure that you knew about it and that we're moving forward. I really want the vaccine to come to us as soon as possible.
All right, so.
President McAvoy, you have one other speaker card on this item.
I see that. I was going to ask Dr. Baker. So this particular comment is on the hubs and pods. I don't know, are you going to be talking anymore? It might be part of the reopening plan. I'm not sure what the specific question is. I guess we could take the comment and then we'll know better unless you
We'll know better when we take the comment, probably.
Okay, well, why don't we go ahead and do that? Let's see, I think it was it Michelle Smith?
Yeah, so I've gone ahead and unmuted.
Okay, welcome, Michelle. There we go.
Hello, can you hear me?
Yes.
Okay. Hi, everyone. It might be a little bit more about reopening. I wasn't quite sure where this would fall. So thank you for taking my comment. I was listening. A lot of my questions were already answered, but one of my questions was, and I think Dr. Baker had alluded to it, is if teachers do agree to be vaccinated, will the district open more hybrid or hub or otherwise classes before the end of the school year? And if there is any, sort of in the next, before June, if there is, or if the district has created sort of a plan in terms of how many students they will bring back to a school site. I'm sure that there are a lot of parents and there's sort of competing issues, whether it be the number of students changing on how many want to come back, and also being able to hire and fund hub teachers, or have, so it's like, I know it's a balance, but I wanted to see if you all had sort of decided on, we're going to cap, each school site to like 20% or 30% before the end of the school year. And the other is around sort of equity and just making sure that how many hubs are open at each of the school site, and making sure that those are distributed equitably, not in just the number of hubs per school site, but also in which students are being invited back to return, sort of focusing on our most neediest or most vulnerable students. So there's a lot more questions than comments, but thank you.
So when we're looking at equity and you look at the learning hubs, you will see that our learning hubs, there are more at our school sites that have our most vulnerable kids. That does exist. That's what's happening right now. As far as planning, is there going to be a percentage of students back on campus before the end of June? I don't know. As I alluded to previously, when we were talking about the vaccines, especially if there are teachers now that feel, well, I'm doing remote, but if I can get the vaccine sooner, I'd be willing to come back. That's a game changer for our schools if that does take place. And so that's why I said that we would need to work with our association, our teachers association, because at this point in time, we do have an MOU with them. And as Wendy and I were speaking earlier, the more that we know about the amount of vaccines and those that are taking it, that will indicate the type of conversation we would like to have with our teachers association. So I didn't get to percentages, I'm sorry. I don't know.
Okay,